Hi,
Cool.
everyone, and welcome back to the Non Traditional Nurse Podcast. I'm Ellie, and today I'm so excited to be joined by Lisa Baldwin, an RN first assistant with more than 17 years of experience. So, thanks for joining us today, Lisa.
Thank you for having me.
So, Lisa has built a long career as an RN first assistant and has also had leadership roles in surgical services. So, she's got a really well rounded perspective on what this path looks like in practice. So, today we're going to kind of talk about what an RN first assistant actually does, how nurses can get into the OR, and what it takes to build a career in this really highly skilled hands on role. So, we will jump right in. So, Lisa, as I mentioned, you've been an RN first assistant for more than 17 years. So, how did you first discover this path and what really made you decide to pursue it?
So I have been a nurse for 30 years. I got my bachelor's degree and I went right to intensive care out of school and worked there for 3 years. And then we relocated and I went to a doctor's office. So when I came back to the hospital, we were relocating again. I was looking for actually a day shift position because they're hard to find. And I had done nights right
Yes.
out of school like everybody has to. And they said, "Well, there's a day shift in surgery." And I said, "Well, okay, I can learn that." So it was really luck that I got into surgery. And you find out pretty quickly you either love it or you don't like it at all. And it's a lot of hard work and a lot of dedication, but I loved it. So I started working. I got to work day shift Monday through Friday. The thought of not working every other weekend anymore like you normally do, I liked that.
Yeah.
I liked the call involved because it gave me some versatility with my finances. If I wanted to make a little more, I could. I could pick up call. So there was a lot of pros to it.
Yeah. Awesome. So, tell us what roles you worked in the OR before kind of transitioning to first assistant.
So when I went to surgery, I obviously had intensive care experience. So I naturally floated to CV, to cardiothoracic surgery. I went to the heart team probably within 7 or 8 months. They recruited me to that team. And to be honest, I was more familiar with the drips and anesthesias part of it than the circulating nurse, the surgery nurse. So you don't really learn it in school, non traditional nursing role.
For
So I
sure.
learned a lot of it on the job. But once I had been on the heart team for a year, the surgeon looked at me one day and said, "You're next. You're going to learn how to scrub." And so
Oh,
I
wow.
learned how to scrub open heart and fell in love with scrubbing. I love all aspects of surgery.
That's so awesome.
Yeah.
So, for nurses who aren't familiar with the RN first assistant role, how would you describe, what you actually do in the operating room on a day-to-day basis?
Right. So once I had started scrubbing, originally surgery was scrub nurses. Now we have a wide variety of people who are training and do the scrub role. It's called a scrub technician. And they come in and they learn just how to scrub the case past the instruments and they learn the procedures. The circulating nurse oversees the entire room. And if she's lucky, she can learn to scrub as well. She starts scrubbing. So, to be a first assist, you have to have worked in the OR at our facility. Every facility has different um, job or policies or guidelines that they create. We created one that you had to have worked as a RN in surgery for 5 years. You have to be a certified operating room nurse, and you can take that exam after working for a year in the OR. And
Okay.
then you have to have scrubbed for 5 years, and you have to have had a well rounded base before you learn your first assist role.
Okay, so there's quite a bit involved in that.
There is. And then we went to a course in Tampa. You go there for a week, you take classes every day, 8 hours a day, take tests. Then you go back to do the clinical aspect of it. It takes about a year for you to complete all the different areas. We had to follow a radiologist. We had to learn more than just what's in the OR. Um, and then you get a certificate when you pass. Now, a side note, I'm an RNFA. I'm not a CRNFA. So you can become a certified RN first assist if you sit for the exam. And I think that I haven't looked lately. It did require 4,000 hours of assisting before
Oh,
you were
wow.
allowed to sit for the exam. Um, it depends on where you are, if your facility, if it's worth doing that or not.
Okay, and I'm sure there some facilities probably will
Require
compensate
it.
you or
Yeah.
pay for it versus others. So,
Mhm. Mhm.
and then okay, once you finally get certified, tell us what you're actually doing, with the surgeon.
Okay, so I still function in all roles. I circulate, assist, and scrub. But when I
Mhm.
function as the first assist, I am the resource for the room. I am the communicator between the surgeon and the room. I should know the procedure better than anyone else and know what he wants. And then when I assist, I retract, obviously. I assist with exposing structures, anticipate needs. And then when we get to the fascia for the closing part, I'll close and he's able to leave the room. So I'll close the fascia, the subcu, the skin, put the dressing on, and kind of direct things from there.
Okay, and then what types of surgeries is this only for cardiothoracic surgeries that typically we see RN first assists, or what type of surgeries do you assist with?
All surgeries. So
Okay.
I do plastic surgery. I do robotic surgery, general surgery, peripheral vascular surgery. I'm not on the heart team at the moment, but I do help out some. But as an RM first assist, you'll first assist in whatever specialty you specialize in. Most hospitals want you to be, and orthopedics, most hospitals want you to be proficient in every specialty, obviously, so you can be utilized for where you're needed.
Yeah, absolutely, and I can't even imagine, what goes into really learning each surgeon and what they want and anticipating their needs because 'cause I'm sure they all are
They're
very
all
different.
you would think, "We're taking a gallbladder out, how many ways can you do it?" There is tons of ways, just tiny little differences that you have to remember and know, but it that's what makes the job interesting to me. It's different
Yeah.
every day. Patients are different. I get to meet a lot of people, talk to them before their procedure, reassure them. Um, when I leave at the end of the day, I have a feeling of fulfillment that I have completed the job, I've put the dressing on, and hopefully they're better.
Yeah, and you kinda jumped right into the next question, but I would love to hear, your very favorite, like, parts of the job and the moments and responsibilities that keep you passionate about it.
Mhm. Um, so surgery is a high stress area, and you do have to have a certain personality to thrive, just like ER nurses are a different breed.
Mhm.
Surgical nurses are a different breed, and you have to thrive on change. My favorite thing is that I like that it's different every day. Like you say, I jumped into that, but that is my favorite part of it. It's what keeps me from being burnout. Is I'll do plastic surgery one day, and you're learning every day. A new surgeon comes, I'm learning a different way. There's different equipment they bring in when they come that I'll learn and learn how to use. So um, I would say that's my favorite part. I love teamwork. I love being part of a team where I'm not just by myself trying to take care of somebody. We're all on the same page working together. And it's a beautiful thing when everybody knows their job and it runs smoothly. Our goal is the surgeon should not have to ask for anything. You know what he's doing, you know what he needs. Even if it's out of the ordinary, you're watching and you anticipate, and he knows you've got his back.
Yeah, that's great. I love seeing when things work perfectly as designed, well-oiled machine. It's so cool.
Yeah.
And I think that the change and adaptability and just the lifelong learning, I think is something that so many nurses really appreciate is learning, growing their skills all the time. So I could see how that could be such a cool part of that.
Mhm.
So, on the flip side, what do you find, throughout your career have been some of the biggest challenges with this role?
The biggest challenge I feel as an RN in surgery is nurses get no training for surgery in nursing school. I've even heard, and I hate to even say it because it's probably a rumor, but some curriculum is even cutting out surgery in their
Oh, wow.
RN curriculum. And really, it wouldn't hurt them because all they do is go right now to surgery and watch a day or two and report back what they saw. But really, there is so much involved in being an RN in surgery, it could almost be a curriculum of its own. And that's hard for me because I see new RNs come in and they are starting from ground zero, where
Mhm.
the scrub techs they're working with get a year-long course before they go back there and start doing their job. So the RN's kind of on her heels to begin with because she's not had that year of intense training. Now, we are working on it in my facility where we do give them excellent training. There's a Peri-Op 101 course that they take. We have an RN educator, but that's been the challenge is them not getting frustrated and saying, this is overwhelming. I went to school and I don't really know any of this."
Yeah, and to break into the OR when you have no experience, and I'm sure, yeah, facility to facility, that range of training
Mhm,
changes so much for
mhm.
sure. Um, so what are your tips, for a nurse working somewhere at the bedside and doesn't have experience in the OR, but really thinks that that would be a path for them, maybe not even RN first assist, but how does a nurse get into the OR?
I would recommend they contact the OR director, and she would probably connect them with our RN educator, and they should shadow someone for a day. Maybe
Yeah,
I know
that's
you do
great.
it in school, but it's not the same, like, really go in there thinking about, "Do I want to be this person that I'm following?" Because it is not for everybody, and you either love it or you don't. So, I would recommend going and shadowing someone, and then really there's openings all the time in surgery. We need people, and we love to train people and have new people come, so it's really if they decide to do it.
Yeah, I totally agree. I remember, watching a surgery as a student and they kind of just tuck you in the corner where you're the
Yeah,
least in the way
don't
and
touch
nobody's
anything. Yeah.
yeah, nobody's talking you through it, and you're not really seeing that what
Mhm,
the nurse is doing, you're watching them do a million tasks at once and things that they've gotten so good at, but you
mhm,
don't really understand, like, what that looks like and how you might learn it, so that's great
mhm.
experience. I think shadowing is one of the best things you can do for any possible job.
Yes, absolutely.
Yeah. So, just I know you talked about it a little bit, but just to kind of break down. So, if you are a nurse in the OR and you want to look at being a first assist, can you walk us through the steps one more time of like what would come next to get to that end goal?
So you would work as an RN for the first year. They would let you go to Central Sterile and learn instrument trays, learn all the instruments. That's a job in itself. I can remember starting out in surgery and one of the scrub techs held up a knife with a knife blade on it and pointed to it like she needed another one. There's like 5 different shapes of knives that they use, and I had no idea which number knife blade that was. So,
Yeah.
you learn a lot your first year. You'll have to be an RN for a year, and then, you would start jumping in as often as you can into the role of scrub, to where you work with another scrub and they teach you how, and then you'll get confident and do your own cases. So once you've done that, they require 5 years experience. Um, but after that year, you can also take your C in OR and get certified in the OR. Then after that, you
Uh,
go to a course. My facility paid for me to go, and,
Wonderful.
yeah, and then I have criteria annually that I have to meet that shows that I'm, qualified to do my job still. Surgeons sign off every year on our evaluation. Yes, she closes with me. Yes, she's competent. We also do local injection for them, so they'll sign off for that.
Okay. Wonderful. So definitely having an organization that is supporting you on this journey is a big
Oh,
part of that.
yes, yes, and it's just, being autonomous. It's really nice.
Yeah. Yeah, not every role, gets that level of autonomy. I just found it to be such a fascinating role, and even when I was working in CTICU, I wasn't really aware that that was even an option, so, just trying to get this out there so more
Yes,
people
I didn't
know.
know either. It just kind of fell into my lap, and I'm one, if there's a challenge, I wanna do it, and
Yeah,
I just the more I heard about, "Oh, I can get certified? Okay, let's get certified," and then there's people which I was, I think, the 2nd group at my hospital to become a first assist. It was not always a common thing.
gotcha. And what bedside skills do you feel like translate best into becoming a nurse in the OR or a first assist in the future?
I think organization, an organized nurse is crucial, time management. OR time is expensive, and we have to be not in a hurry, but efficient with how our flow goes during the day. So she has to be able to handle many, like you say, many tasks at one time. Um, I think also fascination with anatomy and physiology. You get to actually see the organs that you talk about and you see pictures of in a book, um, and just wanting to grow and learn.
Yeah, absolutely.
Mhm.
And then how we kind of like to wrap up all of these interviews, what would be the advice you would give to a bedside nurse who might be listening and thinking, wow, what a cool career, I might be interested. What would be the advice you'd give them?
I would give them the advice to act on it. It's easy to just keep showing up at your job because you're comfortable there and you know how to do it,
Mhm.
but reaching out and doing something new is going to help you and it'll help your nurses around you. Anybody that's growing and learning is going to be an asset. So I would say act on it, contact someone at your hospital and inquire about it and do that shadowing and see if you really think you would like it.
Yeah, and I feel like that comes through in a lot of our interviews is to, take that leap if you think at all it might be interesting, I would say. There's hardly any regrets of people taking a chance and getting out of their comfort zone. It's not always fun right in the moment when you're that novice again and you're
Mhm.
used to being like the big dog on your old floor.
Right.
But people don't regret it because it leads you to, yeah, learning and growing and so many more things and just opportunities you never even knew existed. So, yeah, great advice.
Yes.
Lisa, thank you so much for sharing your experience. You've got so much of it. And I feel like I learned a lot about the RN First Assist role today.
I'm
So,
glad.
yeah, for everybody listening, we hope this episode helped you shed some light on a career path you might not have known much about before. So, make sure you're subscribed to the Non Traditional Nurse so you don't miss future conversations and career deep dives. So, thank you so much for listening, and we will see you next time.